Hi, I'm Dr. Anna Cabeca. I'm a Emory-trained, board-certified OBGYN, also board-certified in anti-aging and regenerative medicine, and expert in functional medicine and sexual health. I have lectured nationally and internationally on women's and men's sexual health, but also vaginal rejuvenation and vaginal health, which is so important. So when I was asked earlier today about vaginal steaming, my first instinctual response is, oh Lord, what are those crazy Californians doing now? What's the next and latest trend going on out there in Western California? I stay secluded here on a little island off the coast of Georgia. I know, right? Who knew there were islands in Georgia? I didn't know till I moved here, basically. But so, we've got this great little insulation going on here, and not so great sometimes. But so vaginal steaming, really, what's next? Well, let me tell you. So that was my first instinct. And then as I thought about it, I was like, oh, fantastic. That vagina needs a lot of TLC, some attention. It needs really to be recognized, honored, and just, treated with a little bit of gentle, tender, loving care. So I looked into the steaming of the vagina to see exactly what's going on. And apparently it's this ancient Korean tradition of genital steaming for genital cleaning. So if you can imagine when easy access to baths, showers, hygiene in general was limited, a therapeutic regimen was to steam the genitalia for cleansing, probably before marriage, before events, or as a treat, who knows. But this vaginal steaming has resurfaced in the spas, no less, of Southern California. And it's quite interesting. So I looked at it. There are a couple different ways to vaginal steam. Now, I wanted to hit on a few big things here. Just a couple topics that the vagina is essential for life, right? Number one, the vagina is essential for life. None of us would be here without it. And we need to recognize that. Actually, I lectured not too long ago to 800 physicians in a room giving a talk on vaginal health, both men and women. And I made them say the mantra, my vagina is essential for life. So it's very important, not my vagina personally, but, in general, the vagina is essential for life. So men and women, also men recognize that they would not be here without the vagina. This is crucially important. As a gynecologist, we can tell a lot about the health of an individual from the vagina. So a healthy vagina is very crucial. This to be discussed in further discussions, but remember that the vagina is essential for health. So that is key. Hormones change as we age, and a healthy vagina has critical aspects, and we want to keep, again, the health of the vagina beautiful. We also need to be guardians of our vagina, right? What goes in the vagina, we want to keep it healthy. No dirty dicks, no infections. What are we using on our bodies? I mean, some lubricants have aspartame. I know, isn't that insane? And what we're using on our face, skincare with the chemicals, we don't want chemicals, right? We need to think, okay, what we're using for skincare on our face is something that we want to eat, would be able to eat, right? We see this resurgence of thyroid nodules. So the chemicals, what we use on our vulva and vagina needs to be clean as well. Chemical-free, and aspartame, I mean, seriously, not healthy. And lubricants or whatever. So guard your vagina. Okay, that's the fourth thing I want to discuss. And the other thing is, and also guard the perception of the vagina. We'll get into that. The fifth thing I want to discuss is hormone treatments that restore the vagina to a healthy flora, to a healthy musculature, to a healthy mucosa, to a healthy function. So we'll talk about that. And the sixth thing is that the vagina self-cleans. And that's another important aspect I want to make. And we'll talk about some spa treatments for that vagina. And that's really important. So what has happened to this perception? Like when you think, okay, vaginal steam baths, thank you, we're not promoting labiaplasties. I mean, I do have issues with labiaplasties because of the image, the self-image of the individual coming in. We want to be very honoring of our own unique anatomy. God designed us beautifully for a reason, right? And each of us have a unique anatomy. So where are we getting these perceptions of, vulva has to be perfect this way, or the labia needs to look this certain size, or you have to be even on the right and the left? We're just not designed that way. We are who we are. And as we age, yes, things change, and that's absolutely okay. I think scarring the vagina with rare exception, or scarring the vulva with rare exception, is detrimental. And it does not heal our, the underlying issues probably that took us in to get a labiaplasty in the first place. I believe that is an issue. And is it because the porn industry has distorted our image of what normal female genitalia is supposed to look like? For heaven's sakes, the resurgence of the Brazilian, where does the Brazilian bikini wax come from, right? From the porn industry. What were we thinking? Did Sophia Loren, Marilyn Monroe have Brazilians? I entirely doubt it. So enjoy the sexiness we have and not compare it to again, that's the guardian. Guard your vagina, guard your vulva, guard your mind and your perception. Allow yourself to experience the true benefit of a healthy vagina without the misperceptions of what it shouldn't look like. Just own your anatomy and accept it. It is perfect for you. And as you keep it healthy, as you love it, it will serve you well. It will serve the purpose, right? And then some. Amazing. The anatomy of the vulva, the clitoris, 9,000 nerve endings to the clitoris. Don't mess with the nerves in the vulva. And that would lead me into discussing overuse of vibrators, numbing the pelvic floor, and causing some issues there too. But let's go on to the vaginal steaming again. So what were we going to talk about? Crazy Californians vaginal steaming. I think interviewed was Gwyneth Paltrow on vaginal steaming, that she has quite enjoyed it. So there's and it sounds yummy. Seriously, God, when you get a steam facial, isn't that yummy? It's absolutely yummy. So what's happening with these vaginal steams? They're using some herbals in it. One of the herbals is a wormwood, and another is a mugwort, which neither sound very appealing, honestly, but here you go. So another vaginal vulvar treatment is using coconut oil, honey, egg white, and steam. Well, you can use essential oils in steam and have a gentle steam, but be cautious of the hot steam, because steam will burn, right? Scald, if you will. And we don't, like I said, guard your vagina. We don't want to at all injure the delicate tissue of the vagina. So here we go. So there are some beautiful treatments to do with the vagina. I'll talk about a couple of my favorite spa treatments that you can try to help, again, keep the tissue healthy, well protected, and well conditioned. So let's talk about why the vagina deserves recognition. Seriously, like I said, the vagina is essential for life, the first point I want to make. And because it needs some TLC, because the tissue is sensitive. And the second point, the hormonal changes. As we age, our body makes goes through some hormonal changes. So let me share with you this slide presentation real quickly here. Is that the hormonal changes that occur as we get older. You can see in this slide that here to the left, the vagina is of a healthy reproductive age female. The tissue has increased rugation, a lot of vaginal folds, a healthy lining, healthy musculature. It's thicker, moist tissue. And as we age, as our hormones decrease, estrogen, progesterone, testosterone, DHEA, we lose the folds. The vagina gets drier, thinned out more, and there's dry and irritated tissue. So steaming will help with, and using herbals or oils in the steam can help nourish the tissue. Now, is it going to get into the uterus? to cleanse specifically the uterus? I don't really see so, because you consider the vagina as a tube, but it's really a elastic, and the folds will essentially come together. So one of the best ways to clean the vagina, just seriously, is taking an Epsom salt bath. It's just normal hygiene. The vagina cleans itself. Now, I don't recommend douching either, because you can introduce bacteria, etc., into the uterus. But healthily taking, a simple bath is very cleansing to the vagina. And using coconut oil or olive oil or almond oil, it can be beneficial at massaging the tissue, contracting the pelvic floor to increase the muscle strength of the vagina can help. Now, a healthy vagina is the third point I want to make. And typically a healthy vagina has a pH, acidic, 3.5 to 4.5. The flora is predominantly lactobacilli, but there are multiple strains of lactobacilli. And we can use vaginal probiotics. We can use a lactobacilli probiotic and insert it vaginally, or use a small amount of water and insert it into the vagina as if you were douching. The other is there are normal, healthy secretions in the vagina, and you can have a creamy, normal discharge. And as you ovulate, there'll be more of we call it a spinbarket, a stickiness to the discharge, an elasticity to the discharge, which is great because that tells you you've ovulated, the good amount of progesterone on board, and a good chance of fertility for the month. So the different glands, vulvar, sebaceous, sweat, Bartholin's, and skin glands all create secretions from the vagina, as well as exfoliated cells and excretions from the uterus, the endometrial cavity, the cervix, and the fallopian tubes. Those are, again, all very normal. In the peri and post-menopause, because of declining hormone levels of estrogen, progesterone, testosterone, and DHEA, the epithelium, or the lining of the vagina, thins out, and the muscle also decreases. There's an increase in pH, and it becomes more alkaline, so women will tend to get bacterial vaginosis, which has a fishy odor and a little bit of a grayish discharge, or be more susceptible to yeast infections. There's a decline in glycogen levels, which is important for, again, the elasticity of the vaginal floor and also for the normal flora within the vagina. So that also decreases as we get older. And, we have to think about concepts of the past. And this is an old cartoon that I have to remember this old cartoon, a woman banging on the door of her husband, of her bedroom with her husband. And the quote is that, let's see here, I can review this. Please, Dave, please don't let me be locked out from you. Gotta love that. And the text of the this advertisement says, often a wife fails to realize that doubts due to one intimate neglect shut her out from happy married love. And it's a commercial for Lysol, to douche with Lysol, and found that to be very interesting. But what happens as we age naturally, there are shifts, but that can be prevented and that can be healed. So if there's disturbance of the normal flora, how does that occur? Well, again, we said aging, the hormonal changes, but douching, an alkaline environment in the vagina, so sperm or some lubricants create an alkaline environment, and that will disturb the vaginal flora. Sperm and semen, nonoxynol 9, can destroy the normal flora, and there's damage to biofilms. Again, the bacterial needs to inhabit, healthy bacteria inhabits the vagina. And we have studied so much on the microbiome as the genetic code was released. We recognize, okay, well, with 23,000 genes versus an earthworm's 99,000 genes, how is it that we're so advanced? Well, we rely on trillions of healthy bacteria within our system to help us function, think, right? Create our hormones. They're symbiotic with us, and that's the microbiome. Same within the vagina. What are things that affect our microbiome? Oral contraceptive pills, antibiotics, and that is like in, the antibiotics you don't even think you're getting from GMOs and from farm-raised food and from, farmed animals that aren't free range or grass fed. And then the pesticides, herbicides, et cetera, they're killing off our bacteria too. Steroid therapy, inhaled nasal steroids for asthma or steroid injections, all can affect our normal vaginal flora, immunosuppression, and diabetes as well. Yeast infections, also a problem, and affect the normal bacteria. And that also, again, disturbed gut ecology. The vagina is an extension of the GI tract, right? Of the healthy intestinal lining. We have similar in function with the vagina. So a healthy vagina, healthy GI tract, and we heal it the same way. So, when we talk about healing the GI tract or, the improving the function of the gut with probiotics, with being gluten-free, dairy-free, removing food sensitivities from your diet so that you heal the GI tract, that heals the vagina as well. If you have recurrent infections, recurrent irritation, etc., it can be from a food sensitivity or an impaired GI tract. So tampon trauma, as we get older, we're using tampons. Using a tampon is traumatic to the vagina. It can cause irritation, itching, discharge, even bleeding. So you being conscientious of that, especially as we're getting older and we're having irregular periods or spotting, frequent tampon use can be traumatic to the beautiful vaginal tissue. So, it's important to also recognize that we really want to rule out infections. If you're having current, chronic vaginal irritation or discharge, itching, burning, dryness, redness, yellow discharge, frothy discharge, pain with sex, and you need to get this evaluated. Yeast infections, you shouldn't have more than one a year. Talked about bacterial vaginosis, the fishy odor. And again, it's just the vaginal flora is off, the health of the vagina is off. So get a little, TLC to the vagina is really important. Coconut oil is antibacterial, antiviral, antifungal. So using that vaginally can be very healing, and then a vaginal probiotic to follow. Trichomonas is a sexually transmitted infection that's become more resistant to our treatment over the years and will have a bloody yellowish discharge, and it's important to get it treated and then be tested for cure and have your partner treat it. And of course, we know of the chlamydia, gonorrhea, and herpes infections that can all cause vaginal irritation and be a sign of infection. So if you're like, I think I need a vaginal steam because I'm having a discharge, please rule out a certain infection. I think that's really critical. The other is HPV, human papillomavirus, which we know about because of our pap smears, testing in pap smears over women over 30 looking for HPV. Does it cause warts, which causes warts or genital warts, as well as abnormal cervical dysplasia or abnormal pap smears. So we want to rule those things out. There are other skin disorders that affect the urogenital tract, and I'll just list them off here versus going into more detail, but just things to be considered. Again, if you're having issues or you feel like your vaginal vulvar area, you're having itching, irritation, pain, etc., these things need to be ruled out by your gynecologist or your primary care physician. So lichen sclerosis, hypertrophic dystrophy, vestibulitis, vulvodynia, malignancy, dermatitis, all are diseases of the vulvar vaginal area that need to be ruled out. Sometimes also pelvic support. So I'm really big on improving the muscle strength of the vagina, using either Kegel balls, doing Kegel exercises, and being conscientious of the types of exercise you're doing. I did a couch talk a while back with Michelle Kenway, who is from Australia and is an expert pelvic floor therapist. And we talked about safe ways to do exercises versus unsafe ways that can actually create strain and pelvic prolapse, weaken the pelvic floor. We don't want to do that. We're not exercising to have a weak pelvic floor. We want to keep the pelvic floor strong so that we are continent. We're not needing to wear panty liners or struggling with leaking when we do activities, because we want a strong pelvic floor and pelvic support. So all that's really important. I always tell my physician colleagues that before we operate, create the healthiest vaginal tissue possible before you operate on it. And that's with my patient doing Kegel exercises to strengthen the pelvic floor. And that's when you actually contract the pelvic floor, as if you're to stop the flow of urine. Hold it for 10 seconds, do 8 sets of 10, and 3 to 5 days a week. Stop sign, when you hear the water run, when you're at a red light, that's a good trigger to say, okay, I got to do my pelvic floor exercises while I'm sitting here, and create that concept when you're exercising, strengthening the pelvic floor as well. But hormone therapy positively affects the pelvic floor, and we'll talk a little bit more about that. You can also use Kegel balls or pelvic floor. They are round balls that can be inserted into the vagina, and they will stimulate the vaginal muscle to naturally contract as they move around, and that will strengthen the pelvic floor. But again, you want to have good, healthy vaginal tissue, or it will also irritate the vaginal tissue. So many procedures that people get when it comes to talking about the vulvar vaginal area are pelvic support and incontinence procedures, or labiaplasty, which I ranted about. I really found in my practice of treating over, thousands and thousands of women, in any case, there was one that, because of prior surgery and episiotomy and a partial vulvectomy, that she need some vulvar repair, but otherwise perfectly healthy and normal. Do not compare yourself with the porn industry. I mean, seriously, are we honoring the porn industry? Those, imperfect issues and less than ideal. And, it is not how we want to compare our bodies to. Just know that we are unique. We are who we are, and it is absolutely perfect. So honor your creation, right? Honor the way you're created, because having surgery can have consequences that you don't want to deal with. And I trained at Emory University in Atlanta. I have seen female circumcisions. I mean, horrendous, traumatic, and let us not be as ignorant. Let us not be as uncivilized as that. We will shout up and complain about pelvic or female circumcisions, but yet here, in many magazines, lauding the effects of labiaplasty. What are you comparing yourself to? Honor your anatomy, honor your differences, honor your uniqueness, and don't allow perceived imperfection to affect your own self-image and your own enjoyment of your body's design. So crucially important. I can't emphasize that enough. So get my point on that. G-shot is a fun procedure that can be done, collagen injected into the G-spot to increase the focus really on the G-spot and the density of the G-spot. So it becomes an area of focus, which mentally triggers sensate focus. You're focused on that area of pleasure, of sensation, and that will increase your ability to have pelvic floor orgasms or G-spot orgasm, however you want to call it, but will increase that sense of pleasure and play and exploration with your partner if that's something you want as an added bonus. And I've done that in many women, doing a G-shot injection using collagen or a type of similar filler that we put in our face, for instance, that is perfectly acceptable, hyaluronan or hyaluronic acid based filler. And that works incredibly well. So a nice little thing there to consider if you're so inspired to have a pelvic floor procedure done whatsoever. I found that to be safe and effective. So hormonal therapies. When we talk about hormonal therapies for the vagina, there's a few ways that, really want to consider that. And this, cartoon that I shared is a beautiful woman saying, go down a water slide while it isn't wet, and then you'll understand why foreplay is so important. Seriously, if you have pain every time you have sex from dryness, will you want to have sex? No, it's a big turnoff. Whether you know it or not, you are subconsciously not going to seek out a way to cause yourself more pain. Certainly not from vaginal dryness. So, hormonal therapies can restore the vaginal tissue and restore it in a very healthful way. We are very familiar in medicine of using vaginal estrogens, and the National Association, National American, was it, at NAMS, Menopause Society, National American Medical Menopausal Society position statement in 2013 looked at women with hormone dependent cancers, such as breast cancer, and looked at the safety of using vaginal hormone therapy. And so, what it found out basically is that a small amount of absorption, systemic absorption of low dose vaginal estrogen therapy is minimal. So it's very minimal. And what the research showed is that women who used vaginal hormones, despite a prior history of breast cancer, had decreased morbidity and mortality. In other words, they lived better, longer, with a higher quality of life. And that's important to look at. So hormones can help with hot flashes, they can help with sexual function and decrease sexual dysfunction. And hormones naturally decline with age. For example, DHEA, one of our adrenal hormones, naturally declines with age. Peaks in our 20s, in our 30s, we start to get the decline. And that is DHEA. You've heard about it over the counter as adrenal hormone. People take DHEA 2, 3, 5, 10 milligrams, men as high as 50 milligrams to help with hormonal support, muscle building, bone health, brain health. DHEA has been shown to help with all of these. So we looked at it in women to help with the vaginal flora. And I used vaginal DHEA and with a high safety efficacy and a high safety profile. DHEA vaginally has been excellently used. Your doctor can prescribe it for you. And the way I would do it would be a prescription of a DHEA vaginal tablet. I used a pharmacy in Colorado called Belmar to make mine because I wanted it tasteless, odorless, and at a pH specific to the vaginal floor. So they designed the vaginal tablets the way I like them. So it was DHEA vaginal tablet, 10 milligram, insert one in the vagina daily for 30 days and then 2 to 3 times per week as needed. And patients would come back in 2 weeks and tell me their vagina is 20 again, not because it just, like estrogen, supported the mucosa, the first lining of the vagina, but it supported all the way to the muscle lining. So the rugation came back, the flexibility of the vagina came back. So no more pain with having sex from dryness. Healthy normal lubrication, healthy function, and healthy sensation. All was restored by simple DHEA therapy. So, would you like to get some water? Okay, go ahead. So, DHEA, and also in looking at animal models, androgens and DHEA have been found to inhibit breast cancer development and growth and to stimulate bone formation. So whatever we can do to help with that, that's hugely important. DHEA has been found to increase bone mineral density and to stimulate vaginal maturation without affecting the endometrium while improving well-being and libido with no significant side effects. Excuse me 1 second. Sorry for that momentary interruption. Middle of the night. Okay, so another study looking at DHEA looked at, DHEA as a benefit as hormone replacement therapy in women and had an inhibitory effect on the growth of human breast cancer. So women don't need to be afraid of using DHEA if they've had a history of breast cancer but the key thing is that you are doing everything possible with lifestyle, etc., to decrease your risk of recurrent breast cancer, right? But DHEA also would not use it vaginally in someone who is currently on tamoxifen. And that is primarily my contraindication to using DHEA vaginally. So if you're currently on tamoxifen, we don't use it. Vaginal therapy is safer than oral therapy, risk-wise. And overall, again, just very safe option for women who are at high risk for embolism. We've seen no risk of that with vaginal DHEA treatment. So, like I said, some ways to use vaginal DHEA are tablets inserted in the vagina for 2 to 4 weeks daily, and then just 2 to 3 up to 5 times weekly as directed. Some of my patients have used it just once a week to maintain the healthy vaginal tissue. They can be compounded in suppositories, troches used vaginally, creams used vaginally combined with testosterone, combined with estrogens, progesterone. I've also used oxytocin vaginally for a couple of reasons as well. So another very key restorative way to support vaginal health is coconut oil. An Ayurvedic ghee, an Ayurvedic practitioner can infuse a ghee with a balancing blend of herbs for your dosha. So it sounds similar to what herbal blends are being used for the vaginal steaming, but also again, it's a healthy fat, healthy oil, and that can help condition the tissue. You can just massage it into the labia, to the vulva, the clitoris, so it conditions that tissue. You can use it, insert it vaginally. And one lubricant I found that was very clean, very organic, and also without chemicals that are otherwise contraindicated. We don't want to put chemicals on our vajayjay at all. So there's a lubricant called Yes, and that's out of England, and I've used that and recommended that one for my patients, which is great. So you want to use something that, number one, is tasteless, odorless, and is without synthetics, without petrochemicals, without parabens, etc., without gluten, without aspartame, please. So I want to just, again, emphasize encouraging positive self-image. We should all be able to maybe not sport a tattoo, but have the concept of our vagina just being beautiful. So I want to leave you with that thought tonight, that absolutely your vagina is beautiful and it is essential for life. So the vulva, vagina, etc. is fantastic. Another treatment that we've done, like I said, what we put on our skin is good for has to be something that we would eat. I've used and I've talked about using my Mighty Maca green formula, which is a great green formula because I was out of a mud mask and I used it on my face. So here now exploring the Mighty Maca Vulvar mask. So just add about a scoop or two of Mighty Maca, a little bit of water to make it a soft paste, and then apply to the vulva, the clitoris, the perineum. Allow it to dry and take a nice little shower and rinse off. So very healing, very restorative, and let me know how you do. So explore, have fun, and honor your body. Honor your body, and don't look for ways to alter it versus ways to honor it, and stay your healthiest self. And that's with being a guardian of your mind, a guardian of your eyes, a guardian of your ears, a guardian of your vagina. Thank you.